John Ogundiran is a doctoral researcher and consultant specializing in indoor environmental quality, sustainability, and energy at the University of Coimbra in Portugal. With extensive experience in engineering and research, John has contributed to several projects and publications showcasing his expertise.
So I will be discussing on indoor environmental quality, gaps, and the risk to public health in the context of developing tropical countries, especially those in Africa. First of all, we need to understand what IEQ is about. IEQ defines the state of thermal comfort, air quality, acoustic comfort, and visual comfort in any indoor space. And so when you have defective IEQ, it affects human well-being, health, and safety. And we all know that the recent COVID-19 has also emphasized the need to keep safer indoor spaces. Of course, the outdoor impacts on indoor, and so what you have going on the outside is an extension of what you have going on the inside. And today, things like the awareness of climate change, which is giving emphasis to the extreme variability of temperature, flooding, biodiversity loss, and all of that are also factors that are necessitating for these kinds of discussion. And we know that many anthropogenic activities, which are activities that are by men themselves, both on the outside and the inside, are contributing to some of these demerits that we have. Of course, there's the GHGs, greenhouse gas emissions, and all of that, leading to environmental pollution. And so these gaps have brought in significant risk to health, well-being, and safety. As already said, COVID-19 was a good emphasis or a reason for the world to stop and think of what is happening in indoor spaces. And I would want to say that it primarily complies with the Sustainable Development Goals 3, 11, 13, and 15 primarily, but indirectly impacts Goals 7, 8, and 9. And maybe in the discussions, we can have questions that will trigger those explanations. But what is the objective today? To provide evidence of existential risk, health risk in tropical Africa due to IAQ gaps, and so also to emphasize the link between outdoor environmental impacts and indoor conditions. And I would explain that as we go ahead. But let me juggle your mind a bit about the importance of air. Several reports, gray and scientific, have estimated that an average sized man would require about 11,000 liters of air daily. This emphasizes the criticality of ensuring that we have adequate air condition, even though a lot of attention is being paid to water and all of that, but we can literally not survive without air. So I just want to say that outdoor again affects indoor significantly, and in the developing tropical context, this is important because we already have several reports and studies, especially on the outdoor, showing that there is outdoor pollution in most of the African countries, especially the developing tropical countries. And there are challenges such as energy, poverty, infrastructural deficits, regulatory gaps, high mortality risk from traffic accidents, unsanitary condition, and then the general lack of awareness and data in tropical Africa. And that's why we're discussing today. But to characterize the developing tropical context, we would like to present the case of Nigeria and the Democratic Republic of Congo. The reason for this is that Nigeria, in terms of population, remains the most populous country in Africa. The DRC is the next in line, which is a population of about 105 million people, or probably more than that, but somewhere around that statistic. For Nigeria, we have about the last poll says about 240 something million people. And then we have similarities in social cultural factors. We have similarities in policy gaps, ethnicity, political and economic instability. These countries are about the wealthiest countries in the world in terms of mineral deposits and resources. We have energy poverty and the overdependence on fossils and inadequate supply and distribution of energy itself even though we have predisposing factors that are need resources that should, give us energy independence. We have poor infrastructure when it comes to transportation, and we also have poor facilities for education, schools, and low research with regarding IQ, and many other similarities. And that's why the cases of Nigeria and DRC would stand representative of the developing tropical context. We're using a methodology which we would say is empirical and experimental because we're presenting assessments from field studies and some of the reports that have been given in other publications or related publications regarding Nigeria and the DRC. I would like to mention that most of the work that is presented here, I share either co-authorship or sole authorship of those works and some of my colleagues in the field. Which we reported on transport and hospital buildings. But in order to justify this, we first of all performed a review of IAQ in transportation vehicles or public transport vehicles for tropical countries as a whole in the world and subtropical regions. And the primary findings show that there's an imbalance in research concentration, where we have about 78.2% of the studies from tropical Asia. For sub-Saharan Africa, which is the subject of discussion today, we have very low research, not exceeding 8.2% or less than 10%. Latin America also accounts for about 11.8%, while Australia and Oceania, obviously, we know why that is the case because not every part of Australia is solely tropical, but we were able to find some studies in that region. Of course, the main emphasis was that there's poor IEQ infrastructure itself, technology in buildings and vehicles, and also the ambient pollution, traffic hotspots, overcrowding, extreme heat loads are some of the reasons that have contributed to poor IEQ in the region, as we found in literature that was reviewed. These gaps are basically emphasizing that there's insufficiency of studies or awareness, or some of these things are not properly looked upon in the academic sector or research sector. We have lack of effective or complete absence in some cases of IQ regulation, and we have limited attention to the region. And so this is also supported by the second review regarding IQ in hospitals and buildings. And we found out that for Africa, again, we just saw about 7 studies or 8 studies. It depends on what you're looking at. IAQ or ITC, which is either air quality or thermal comfort. And you have, because America is low on that report because not every part of it is tropical. But for the places that we found that were tropical, we saw that there were low studies too, but that is understandable. In Asia, we have more studies which corroborates what we found in the case of vehicles, and then the Oceania, the same thing. And so all of this summarizes the fact that there are gaps in this region. And like I already said, more studies have been done for tropical Asia. Africa has low studies, South America, low studies, and the tropical Oceania, despite the fact that we have large population or geometric population, and this region will host several of the mega cities by 2050. We have poor research, and there's need for emphasis in this region. If you have questions regarding some of the findings, I guess during the forum we may even emphasize more. But this was the reason why this became an area of interest in our work. Some of these are graphs to show the poor state of indoor climate. This was a study regarding trains and with passenger waiting areas and was conducted in Nigeria. If you can see the graph, for the trains, they were new because this is just one of the first effective train systems that have been, will I say, resuscitated and just in modern times. So the trains are new, but I will emphasize that there were gaps when it comes to the entry of particulate matter into the cabin. So the air conditioning systems are working well, but we still found out that there was high PM level in the trains. We had high noise levels, reported, and all of this define IAQ. And we also see that in terms of thermal comfort, if you look at some of the values on the graph, you will see that in the cold sensation region, people are feeling cold sensation because there was almost an overcompensation for thermal comfort because everybody thought that it was a hot region, and so the parameters were not rightly set. But all of this emphasizes that there are gaps in IEQ parameters, even in the trains and passenger waiting areas. We can discuss this better if you have more questions later. This is a summary of some of the things that I've been saying, that the PM index indicated cooling overcompensation from air conditioners. And only 5 of the 15 train trips met the EN 13272 standard in terms of illuminance, because for trains, being that some of the journeys could be long distance, it's important to have visual comfort. Fresh airflow and exchange rates were inadequate in 60% of the train based on the PM evaluation for 2.5 and 10. And if you notice, the standards that were referenced mostly are international standards, not local adapted standards in the region. This is a study showing noise in hospitals, 2 hospitals in the DRC. Incidentally, in one of the region, for instance, Kinshasa, one hospital is just a few hospitals, less than 10 hospitals or 5 hospitals are serving about 17 million of the population of Kinshasa. But so it was interesting to assess the exposure to noise, being that on the size of the hospital, you have them co-located with mining companies, industries, and all of that. And the report is indicative that there's clear violation of what the WHO recommends. If you look at the report, where you have 82.6 dBA in terms of the noise level exceeding the recommendation, in most hospitals, it shouldn't be more than 35 dBA. In the other hospital, you have about 70 dBA in terms of the noise level, equivalent noise level. So we recommend that there should be changes and there should be technological interventions to ensure that there is some rectification of the exposure to noise in those hospitals. For this case study, we assessed the conditions of exposure in school buildings, and we are able to confirm also that due to the proximity of the buildings to industries, as you can see from the figure 2, they are cited in industrial zone. We also access some in commercial zone. There is limitation in ventilation parameters and other IEQ parameters that we observed there. And so there is susceptibility of poor performance of school students and even tutors in school buildings. There is the possibility that there are risk to the health of these peoples and students, young students, and they are within the vulnerable groups. So there is need for some intervention. The truth is that there's complete absence of policy to regulate IEQ in this region. The summary of these findings show that gaps exist and there's risk to public health in terms of transportation, hospitals, and school buildings. And we have some studies to corroborate some of these statements that we have made, or these findings. In terms of noise, we have assessed the parameters that are contributing to this to the existence of high traffic levels, industrial activities and socioeconomic activities, and sometimes cultural activities like unregulated parties and the behavior of people. We have clear policy deficit because in many of in these 2 countries and many other regions, there's absence of IQ awareness and regulatory framework, and this is also linked to poor low study in the region. We have For sure, there's risks to thermal comfort considering that temperatures are rising, and there's also pollution in the air contributing to poor IAQ, both on the outside and the inside, linked to both vehicles, industries. In Congo, you talk about mining, farming activities, poultry, animal rearing, bush burning. Indiscriminate bush burning is a common practice in developing tropical countries, especially the sub-Saharan. And several studies have also shown that indoor cooking is another source of discomfort and poor IAQ in buildings. And we also have visual discomfort. Of course, the energy gap and poverty are contributing factors. Again, to emphasize, there's a risk to IAQ and public health. These necessitates for poor health impacts. We have occupational stress, and again, lack of regulation will not enhance the good participation of stakeholders, being both occupants, industry owners, transport stakeholders, and all of that. There are social factors that predispose the people of this region to poor hygiene practices. And since there's even absence of regulation, this becomes a gap in the region. Now, today, we have the problem of climate, energy poverty, poor infrastructure in transportation, and the region is known for the high use of second-hand vehicles. And so there's a high level of emission. And since we have a city like Lagos, full of traffic, and most man hours are lost in traffic, we have a very serious traffic condition causing pollution on the outdoor, and the extension of poor air quality on the outdoor to the indoor in vehicles and buildings. All of these are reasons for us to focus on IAQ conditions in the developing tropical context, because when you look at the developed countries, such as in Asia, Europe, and America, many of these gaps have been, to an extent, researched and taken care of by policy frameworks and even technological inventions. These gaps remain in the tropical context, and addressing these challenges require holistic approach involving stakeholders and policymakers. Collaboration is essential for sustainable development and the improvement of well-being, since we have geometric population tendencies in this region. I'm hoping that as part of the awareness campaign, webinars like these and the participation of the audience wherever we are in the world will sensitize us towards actionable activities or relevant activities to mitigate the risk that are associated with IAQ gaps in this region. Thank you for listening to us. We recommend that more studies be done, that we develop better infrastructure in the region, improve the IAQ management in these hospitals and other indoor spaces, and enhance sustainable transportation policies to reduce environmental impact. Thank you for listening. I look forward to discussions and questions if you do have any, and feel free to contact me. I look forward to another time. Thank you.